Now, Ghana is set to introduce a new vaccine to deal with increasing cases of malaria-related deaths. The vaccine, known as RTS S malaria vaccine, will be piloted next month in 6 regions. The selection of the pilot regions was based on their high prevalent rate of malaria, child mortality patterns, among other factors. Now, this is the first time a vaccine has been introduced in Africa to fight malaria. The vaccine, which will be administered based on age, will be given to children in not only Ghana, but also Kenya and Malawi, who are 6, 7, 9, and 24 months old. Let's take a look at the statistics. Yep, so at the moment, Mosquirix or Mosquirix is the name, the common name for RTS. It's an injectable vaccine developed to protect against the P. falciparum malaria in children. It stimulates the body's own immune system to defend against the disease, and is designed to prevent the parasite from infecting, maturing, or multiplying in the liver. Now, the World Health Organization just in 2017 announced the approval of the country's request to participate in the pilot implementation alongside Kenya and Malawi. So Ghana is in, and we're going to learn a bit more about it. We're joined in the studio by Dr. Kezia Malm. She is the manager at Malaria Control here in Ghana. Dr. Malm, how nice to see you. Thank you for your time.
Thank you for having me.
Right. So Ghana was keen to participate in this. But I'm guessing parliamentary approval didn't create as many headaches as the proposed Ebola vaccine trials
No.
caused.
And it's because this is not a trial. This is actually a routine implementation of a vaccine introduction. So the Ebola one was a trial. There has been a lot of trials already. In fact, Ghana participated in the trials when it was being done. It was tried in Agogo and Kintampo. So we moved beyond the trial stage. It's just that we are blessed to be one of the countries piloting the implementation. Usually when vaccines are tried and tested, before it's introduced, they pilot it in some countries. But we haven't had the chance of piloting. So I think we had a chance for one of the previous vaccines, but we are not using that vaccine on a large scale. And Ghana has a chance to be part of the implementation.
Tell me again about the ages of the children that will be benefiting from this.
So it's a 4-dose vaccine. The first time a child gets it is when the child is 6 months. Then you have another dose when you're 7 months, 9 months, and then 24 months.
Right.
So 1 month apart for the first 3 doses, and then a bit later for the last dose.
And these children will live the rest of their lives never getting malaria?
Not like that. You know, malaria is a very difficult disease, so it's a number of interventions that we put together. The trials show that the vaccine helps reduce the incidence of clinical malaria. If you take 10 cases of malaria, it will cut down 4. So it reduces it, but it doesn't completely take away. You know, most of the vaccines reduce your chances of getting the disease, but it doesn't completely take away. And in fact, for this particular one, the trials were done with people having other interventions. So it's an additional tool. And it's very important people understand that when you have the vaccine, it doesn't mean that don't use the other interventions that are being promoted for malaria, because together they all work in protecting you from getting malaria.
Is this going to cost us anything?
It's within the routine system. So just like all the other vaccines, the parents are not going to pay anything. But the government of Ghana, together with the partners, WHO, Global Fund, Unity, are paying for the cost of the vaccine.
Right. Were there many other countries that applied to be part of this pilot?
A number of countries, unfortunately, because I wasn't part of the vetting committee. It was vetted by WHO, the global WHO office. A number of countries applied, and only 3 were selected.
Okay, we were approved in 2017.
Yes.
What's the reason why it's taken a couple of years to get this going?
It takes a lot of preparatory activities to get to start. Even coming to quantify the number of children who need the vaccine, and getting the manufacturer to produce the vaccine takes a while. Getting the policies and the guidelines in place takes a while. So it's been work since 2017 when we got the approval till now. Lots of work.
Now, malaria, it's one of those diseases that a little bit of sanitation would probably go a very long way in helping us control. Is that still a campaign that's being pushed now that there's a vaccine to ease the the pressure? Are we still going to be trying to push for, you know, sanitation and cleaner environments?
Yes, certainly. I'm hoping that when you mention sanitation, you are thinking about taking away the breeding sites of the mosquito. So certainly, but if you realize that that is not the domain of the health service, so we advocate with the local government, with the roads and highways, for them to be taking care of that, and it's still on the table. We can never do without it, so it's still ongoing.
All right. Now, we've seen instances where we have shortages of, you know, vaccines and so forth. How are we shaping up for this malaria vaccine? Now, do we have enough stock so that babies in the country will all get access to it in the areas designated?
Yes, we have a target of getting to 120 to 150,000 children per year for about 2 to 3 years. Currently, we have received currently we have catered for 400,000 vaccines. So we are well covered in terms of ensuring that the children who need to get them do get.
So you won't have to choose which children get it, which ones don't?
No, once you are in the district that is having the vaccine, you should get the child.
Will get
once you are at that particular age. No rationing. We usually don't even ration vaccines, you know.
Oh, I didn't say you do. I was asking whether you might have to with this new one.
No, we don't.
Especially if the demand is quite high. But you seem to have prepared for that eventuality. Right, what else do we need to know about this and how it will be implemented?
So guardians and parents need to know that it's an injection that will be given on the left thigh. We, just like any other vaccine, you are to come back to tell us if you have any side effects. I mean, the normal side effects that we get from vaccine, a bit of local reaction, there's sometimes a little fever. There will be a lot more education as we go on, but we need to know that it's taking place in formerly 3 regions, now 6 regions. So Bronga Hafo, now the Bono Eastern Hafo, Central region, and then Volta region, which is now Volta and Uti, in 33 selected districts. We selected the districts based on random computerized system, just to make sure that we have other districts within these 3 or 6 regions to be able to compare lessons learned, and moving forward we can improve on what we do.
Exciting times ahead. Dr. Kezia Malm is from the Malaria Control Center, is that right?
Program.
Part
of the Ghana Health Service.
Part of the Ghana Health Service. We thank you so much for the education.